The mental health movement has been growing steadily over the past few decades, but progress hasn't hit everyone equally. In fact, there's a pretty large racial and gender discrepancy. The National Institute on Minority Health and Health Disparities show African Americans are 20% more likely to experience serious psychological distress than white Americans. This can present as sadness, hopelessness, and feeling that they have to dedicate extra effort to everything they do, just to name a few examples. When Black Americans do have symptoms, data shows they're more disabling, persistent, and treatment resistant than symptoms experienced among white people. And when it comes to gender, women are more likely than men to seek help. Now, mental health is an important topic that does affect everyone, but experts say when looking at different populations, there's contextual differences that have to be addressed. Now, this isn't racism in medicine like the early days when white doctors believed Black patients were more pain resistant, or Black athletes had some type of weird physical advantage compared to their white counterparts. Experts are talking about generational trauma, systemic oppression, these man-made problems that have created a mental health storm for Black Americans, specifically men. To dive deeper, we spoke with Lazarusman Community Counseling Services in Muskegon, which has a unique mission to close the gap.
Michigan is far from a mental health desert. In fact, it usually ranks in the high to middle range when compared to the rest of the nation's care. But some cities within the state are still struggling to meet the growing need for resources. In Muskegon County, there's a ratio of about 410 people for every one mental health care provider. These numbers already make it difficult for those seeking care to find help, but it becomes even more complex for Black men.
One of the questions I'm often asked is how come Black people don't come to counseling as much? They do, and it's changing and it's getting better, but historically African Americans their comfort was rested in the church. It was a spiritual thing. And that also being a spinoff of racism.
Cedric Scott has a unique experience in Muskegon County, being one of few Black male mental health professionals. He runs his own practice, Lazarusman Consulting, and leads the Center for Racial Health Equity, aimed at creating fair systems and resources as it relates to mental well-being.
Because racism, if you think about it, is designed to marginalize, undervalue, under expectation. That creates an inordinate amount of shame. For example, if I'm being identified as a depressed person, and being depressed is shameful, I'll do anything I can to avoid that label.
Being forced into racial and gender stereotypes, experts say Black men can become dehumanized over time and their emotional needs invisible. The National Alliance on Mental Illness cites data showing 63% of Black people believe mental health conditions are a sign of personal weakness.
There's all a machismo kind of thing, if you will, to be strong, we can handle it on our own, just suck it up, you'll be all right, it'll be better tomorrow kind of mentality. That's prevalent as well. But again, not showing weakness when you're constantly being challenged by the stigma or the pressure of marginalized, undervalued, under expectations. If I show that I'm weak, then clearly, see, he is. He just can't do it. He doesn't have what it takes.
When you look back on U.S. history, was there ever a time Black men weren't forced to be resilient, fighting to survive and exist within brutalizing systems? Scott says these sentiments are still at play today, but hiding in a different light, especially when it comes to health.
We're talking about mental health, how it affects the African American community. There's a constant, I wouldn't even say ebb and flow, but there's a constant flow that hinders the access to mental health as well as medical services. The key element of so many of our mental health as well as our physical health issues are the constant levels of stress. African Americans are twice as likely to have hypertension, twice as likely to die from diabetes. Again, what we're talking about is individuals running away from mental health counseling versus coming to. That is why, again, I suggest that the numbers are so high in our population.
But stigma isn't the only barrier to care. Scott cites mistrust in the medical field as another high factor.
That social cultural conditioning aspect of things has gone down for generations, and I'd even wager to say it's in our DNA. Being strong, quite frankly, having the opposite, under expectations for society around us, lack of expectations from the medical field, because of the atrocities been perpetrated upon us for so long. You've had the Tuskegee experiment, very well publicized, so you know about that. My folks know of other experiments as well that were passed on to me. So there's always a level of fear and lack of confidence in the overarching society.
The 1932 syphilis study at Tuskegee was orchestrated by the U.S. Public Health Service to explore the damage untreated syphilis does to the human body. Researchers specifically recruited Black men as test subjects, 600 total, 399 of which had the disease, but there was no informed consent. Participants were only told they were being treated for bad blood. Despite a cure for syphilis being widely available just over a decade later, none of the participants were offered treatment, as researchers wanted to track the disease's full progression. It's estimated around 100 people died as a direct result by 1969. The study wouldn't end until 1972. Among other racist medical notions was the assumption that Black people didn't feel pain as intensely as white people, an idea many African Americans say still plagues clinical settings today.
In other words, the patient says, "Hey, I'm in pain." The medical provider, not being of a different race, looks at the patient and say, "Well, that's should not happen because you're Black. You're built to withstand more pain than most. You don't suffer pain like other folks." That discriminatory process built on a premise of racism, right? My physician, it was kind of weird to me that he came in and he had this solemn look on his face, and he sat down and he said to me, he says, "Now, if you're honest with me, just be forthright with me, we'll be fine. We'll have a good relationship." I thought that was a no-brainer, but he felt the need to come in and say that to me.
Scott says ideally there'd be diverse providers with trusted, culturally responsive care options, but representation is lacking. In 2015, a study by the American Psychological Association showed only 4% of psychologists in the U.S. workforce were Black. Now, today's shortage isn't necessarily unique to other years, but it does come at a time that industry leaders are calling a mental health tsunami for Black men.
Think about the pandemic, where we were isolated, when we were really afraid to touch each other, and you take a look at that and compound yes, it's here now, right now, finger touch away, and seeing that gory those graphic deaths, murders, and then having no one to talk to about it, no one to process this whole thing, no one to really process with them while you're in lockdown.
But even if there are enough providers to do the work, Scott says access is a whole other issue.
Can I ask how much of your clientele is African American?
Now, this is yes, you may. And the answer, contrary to what you would think, is probably 20% African American and probably 80% Caucasian and other. And now here's the twist: resources. They can afford it.
Despite national poverty rates hitting a historic low for Black communities in 2019, data shows Black Americans still face the highest poverty rate compared to other racial groups in Michigan. And in 2020, more than 10% of Black adults in the U.S. had no form of health insurance. The U.S. Department of Treasury admits the nation's history of racism has impacted the economic ability of communities of color, and with that, healthcare falls as a domino effect.
The bottom line of racism is who gets what. It's a race for wealth, race for resources. And so whenever that happens, it's the people who are in power of the institutions, the community, over a certain population of people that decides what that population get. And if that institution says we think this group of people deserves less, which is racism, then they get less and they suffer more. Do I aspire to the fact that racism is going to be cured? I don't think so. Not in the country where racism was created. dictate the wealth of the country, but we can make progress with that.
Scott says raising awareness about mental health is the biggest thing Black men in outer communities can do, whether that's through youth programs, word of mouth, or even workplace education. He cites celebrities like Jay-Z and Kid Cudi, sharing their own experiences and elevating the conversation.
I like to see more of it in terms of counseling being not this boogeyman or disease or something, or slime, as more or less something that is welcoming and helpful. You need more places where these people can come in, at least get the initial intake, get the dose of hope.